Caro, yellow sissy, Caro, yellow baby, Caro, yellow sissy, Caro, yellow baby, Caro, take my money, follow you. Oyibo run away, Caro they cry. Caro, take my money, follow you. Oyibo run away, Caro they cry. Caro, yellow baby, Caro, yellow baby, Caro, fine fine baby, Caro, yellow baby, Caro, take my money, follow you go. Oyibo run away, Caro they cry. Caro, take my money, follow you go. Oyibo run away, Caro they cry. Caro, so younger. Caro, so younger. Caro, so younger. Caro, so younger. Caro, take my money, follow Oyibo. Oyibo run away, Caro they cry. Caro, take my money, follow Oyibo, yeah. Oyibo run away, Caro they cry. Money, Caro, yellow sissy, Caro, yellow baby, Caro, yellow sissy, Caro, yellow baby, Caro, take my money, follow Oyibo. Oyibo run away, Caro they cry. Caro, so Oyibo. Caro, so Oyibo. Caro, so Oyibo. Caro, so Oyibo. Caro, take my money, follow Oyibo. Oyibo run away, Caro they cry. She take my money, follow Oyibo. Oyibo run away, Caro they cry. Caro, take my money, follow Oyibo. Oyibo run away, Caro they cry. cry. She take my money, come on to Oyibo. Oyibo run away, Carol they cry. Carol, yellow baby. Carol, yellow sissy. Carol, yellow sissy. Carol, yellow baby. Carol take my money, follow Oyibo. Oyibo run away, Carol they cry. Carol take my money, follow Oyibo. Oyibo run away, Carol they fly.
comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family. And the truth, you know, love is all we need. We are the world. We are the children. We are the ones who make a brighter day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, we make a better day. Just you and me. Well, send them your heart so they know that someone cares, and their lives will be stronger and free, as God has shown us by turning stone to bread. And so we all must lend a helping hand. We are the world. We are the children. We are the ones to make a brighter day. So let's start giving. Oh, there's a choice we're making. We're saving our lives. It's true, we make a better day. Just you and me. We get down and out, and there seems no hope at all.
Good morning.
But if you just believe.
Good morning, distinguished guests. Ladies and gentlemen, we apologize for starting late. We want to say quickly that we're all set and all our guests are already around. However, we are expecting the arrival of the chairman of this awesome occasion, the person of the Vice Chancellor of the University of Ibadan, and we are told that he's almost here. So we want to plead with everyone to give us a few minutes. On arrival of the chairman, we will be starting. Thank you very much for your patience.
There's a place in your heart, and I know that it is love. And this place is much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving. If we try, we shall see. In this bliss we cannot feel. There are dreams, we stop existing and start living. Then it feels that always love's enough for us growing. Make a better world, make a better world. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for living, make a better place for you and for me. And the dream we were conceived and will reveal a joyful face. And the one we once believed and will shine again in grace.
1, 2, check.
Then why
Check, sound
keep
check, 1, 2.
straining when this earth crucify its soul? Though it's plain to see this world is heavenly. Be God's love. Let it fly so high. Let our spirits never die. In my heart, I feel you are all my brothers. Create a world with no fear. Together we'll cry happy tears. See the nations turn their swords into plowshares. We could really get there if you cared enough for the living. Make a little space to make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough.
Let your power flow in this place. Let your healing come in this place. I call for signs and wonders in this place. Let your presence show in this place. Oh, yeah. Anointing, follow me. Your mercy will I seek. Just like the days when power parted the sea, your power remains the same. Yes, you never change. Fi agbára rẹ̀ hàn. Fi agbára rẹ̀ hàn. Fi agbára rẹ̀ hàn. Oyoma. Fi agbára rẹ̀ hàn. Fi agbára rẹ̀ hàn. Fi agbára rẹ̀ hàn. Oyoma. I worship you. Alágbàwí mi o. I adore Jehovah. Elédùmarè. I depend
You say you never ever got over me, even when you travel overseas. Yeah. Well, I don't mean to brag, my vibe is attractive. You say you stay loving me globally, you want me horizontally. Nobody like me is freaking fantastic. This nigga in the middle of a crisis. You fall in love, you don't know what the price is. My wallet over the enter. He said dirty December. She leave me out, so bad, and now she gone, so bad, so bad. She look like a dama, but she give me wahala. Oh, she leave me out, so bad, and now she gone, so bad, so bad. She look like a dama, but she give me wahala.
Why you dey give me mixed signals? Know like you got that ring on your finger. Even if you don't want to end you, but you know I got the energy to enjoy you. The kind of woman every man desire. Top class, she the rough designer. And she dey go, she dey quench my fire. Wah, wah, wah. Oh yeah, nah. Auntie, pa me. What the heck, pa me? Pity, oti. Oh, love me, nobody. Oh yeah, wait and see. Oh, love me, nobody. Oh yeah, wait and see. Yeah, yeah. Auntie, pa me. What the heck, pa me? Pity, oti. Oh, love me, nobody. Oh yeah, wait and see.
Because of you, I be on the phone all night long. Oh. Don't be smart when you do it to me. Oh no, no, no. I be on my business, shawty, but you be on my mind, shawty. Let me, all of my honey, Kiss me to the cellular, kiss me to the phone. Can't you see I'm into ya? Can't you see I'm in love? Kiss me to the cellular, kiss me to the phone. Yeah, messing with my medulla. I can't talk alone. Oh no, no. Emiliano, 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 no. Emiliano, 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 no. You're one in Emiliano, 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 no. My Emiliano, 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 no. Girl, I wanna know what it feel like, what it feel like. Like I know I see be for real life, for real life. In my condo, loving up your body in fast and slow mo. If I hit you, it's my combo. Can you never ever let me go? Dancing kiss me to the cellular, kiss me to the phone. Can't you see I'm into ya? Can't you see I'm in love? Kiss me to the cellular, kiss me to the phone. Yeah, messing with my medulla. I can't talk alone. Oh no, no. Emiliano, 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 no. Emiliano, 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 no. You're one in Emiliano, 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 no. My Emiliano, Emiliano.
This clan every time. Daddy no get salary. 10 years I no see money. Stepmother no care. Landlord do this. My brothers are hungry. Daddy got the money. Make I go fully. I go fully, but I no go class, daddy. I am sorry. Everybody, I don't date do yahoo. I don't date take banku. I'm a pastor, see one. Everybody don't say I want me, I know they lie. Everybody know. Don't say I want me, I know the lie. Yeah, I don't really care about your body type. What really matter now your vibe? I be the one for you, one for you. Don't really have to be the one to go. Ain't nobody fine like you. Girl, I be the one for you, one for you. And I feel like I've known you my whole life. Feel like I need you in my life. Nobody fit tell me otherwise. This baby will be mine. I feel like I've known you my whole life. Feel like I need you in my life. Nobody fit tell me otherwise. Everybody does say, oh, mommy, I know they like. Mama, me a good, mama, me a good, mama, me a good, mama, me a good, everybody does say, oh, mommy, I know they like. Mama, me a good, 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 everybody does say, oh, mommy, I know they like. Pick up my call. Baby Zoro. Girl, I be the one for you, one for you. My body on you, your body on me. Sweet past sugar. Baby, now you're under them. Simply because. And I feel like I've known you my whole life. Feel like I need you in my life. Nobody fit tell me otherwise. This baby will be mine. I feel like I've known you my whole life. Feel like I need you in my life. Nobody fit tell me otherwise. Everybody does it. Oh, mommy, I know they like. Mama, me a good, mama, me a good, mama, me a good, mama, me a good, mama, me a good. Everybody does it. Oh, mommy, I know they like. Mama, me a good, mama, me a good, mama, me a good, mama, me a good, mama, me a good. Everybody does it. Oh, mommy, I know they like.
Attention, please. Please, everyone who is here for the induction ceremony should please see Mr. Emmanuel Aliyu at the far left corner of the hall. If you are here for induction, please see Mr. Emmanuel Aliyu at the left corner of the hall, towards the back there. Is beside the air condition. So please see him there right now. Thank you. We'll be starting very shortly. We were told that the chairman is close by already. So in the next few minutes, once the chairman arrives, we will start. Thank you very much. Please bear with us, and we're sorry for the inconvenience. We have the arrival of the chairman of this occasion, the Vice Chancellor of the University of Ibadan, here ably represented by the Provost, College of Medicine, University of Ibadan, Professor Olayinka Omigodun, Professor of Child, Adolescent, and Psychiatry. And with the arrival of the chairman of the occasion, we will be starting in earnest.
Welcome to the 6th Scientific Conference of the Association of Clinical and Academic Physiotherapists of Nigeria, Oluyole 2022. In 2017, we were in Ife. In 2018, we were in Enugu. In 2019, we were in Port Harcourt. In 2020, we were virtual. In 2021, we were in Eko. Now, in 2022, we are live in Oluyole, Ibadan. Without further ado, we are sure you are in for a wonderful time. The LOC and the National Executive Council are ready to give us a pleasant experience. Please sit back and enjoy. Thank you.
Can we put our hands together again for the Assistant PRO of ACAPN? We are starting, as we said, in earnest, and we want to urge everyone to please minimize the movement. Everyone outside, can you please come inside? The scientific conference has begun already. We want to crave the indulgence of the chairman and distinguished guests that every one of us should be on our feet as we take the Nigerian national anthem. Can we please be upstanding, everyone, wherever you are in the hall and outside the hall, as we take the first and second stanzas of the national anthem. Thank you very much. We'll take the Oyo anthem now, please.
Aṣíwájú ni wá, aṣíwájú ni wá, aṣíwájú ni wá, aṣíwájú ni wá. Ipò aṣíwájú l'Ẹlẹ́dùmarè fún wa nípínlẹ̀ Ọ̀yọ́. Ìpínlẹ̀ Ọ̀yọ́ ẹ jẹ́ ká ṣe gírí, ọmọ Ọ̀yọ́ ká tẹpá wa mọ́ṣẹ́, ká bára wa sọ̀rọ̀, ká sòdodo, ká ṣohun tó tọ́ tó dára nígbà gbogbo, níbi gbogbo fún ìpínlẹ̀ Ọ̀yọ́. Kò ní rẹ̀yìn o, lójú mi, kò ní rẹ̀yìn o. Kò ní rẹ̀yìn o, nígbà tèmi, kò ní rẹ̀yìn o. Èmi á ṣohun tó tọ́ tó dára nígbà gbogbo.
Thank you very much. A round of applause as we take our seats, please. I noticed that all our guys in front were the only ones singing the Oyo anthem, while the rest of us could not resist shaking to the left and to the right because it was a very sonorous and melodious anthem. Ladies and gentlemen, we will be going now to introducing our guests, distinguished guests and dignitaries who will grace this awesome occasion. And first we have to the high table, and I would like us to, with a wonderful round of applause, recognize the presence and welcome the Commissioner for Health of your state, Dr. Bode Ladipo, who is here ably represented by the Permanent Secretary of your state's Ministry of Health, Dr. Shoji Adeyanju, the Director, the Permanent Secretary of your state's Ministry of Health. Can you put our hands together for the PS here representing the Commissioner of Health, please? He is accompanied by the Director of Administration and Supply. Yes. We are waiting for him to come to our table. Please put your hands together as he comes in, please. Keep clapping on the commissioner sits down. He will be walking to the right extreme corner of the high table. Keep clapping. Thank you, sir. You're welcome, sir. He's here ably accompanied by the Director of Administration and Supply of your state, Mr. Jayeola Zakios. Let's put our hands together. Omigodu, Professor of Child and Adolescent Psychiatry. Please keep clapping as the Vice Chancellor comes to the high table. Keep clapping, please. Keep clapping. You can do better than that. Until she sits down, please keep clapping. You're welcome, ma. Thank you very much, ma. And he is accompanied . Next, we want to welcome and recognize the Chief Medical Director of University College Hospital, UCH Ibadan, Professor Jesse Otegbayo, ably represented by the Deputy Chairman, Medical Advisory Committee, Research and Ethics, UCH, Dr. Mike Obaro. Keep clapping, please. Keep clapping for the CMD, who is here, represented by the DC Mark. Thank you, sir. You're welcome, sir. And next here, we want to recognize and welcome our own Director of Physiotherapy, or your State Management Board. She's here, live and direct, Mrs. Olufunke Okwade. Please put your hands together for our director, please. Put your hands together for her. You're welcome, ma.
To my table, the keynote speaker of today. She is no other than Professor Aderonke Akimpelu, a professor of physiotherapy. Please clap for her. Keep clapping. Keep clapping until she sits down. Thank you. The next is, I welcome to the high table the guest lecturer for today. He is no other than Professor Olaiton Chonyonwo, permit me. So a professor of anesthesia. Please keep clapping, keep clapping. Same light.
Can we put our hands together for the chairman, the vice chancellor of the University of Ibadan? Put your hands together for her, please. Thank you.
Without much further ado, I want to welcome to the high table the president of the Association of Clinical and Academic Physiotherapists of Nigeria. Put your hands together for our president. He is no other than Dr. UAC Okafor.
The number one physiotherapist in Nigeria. I thought you would make it louder than that. Come on. When you are asked who is the number one citizen in physiotherapy family, he is Dr. UAC Okafor, the only golden packager in physiotherapy. You're welcome, sir.
I want to welcome to the high table Board of Trustees.
Adegoke. Put your hands together. Hospital Ibadan. You're welcome. And of course, we want to recognize as well the members of the Board of Trustees of ACAPN here present. We already have in our midst the chairman of the board. I want to recognize quickly a member of the board of awards unit, Elder Babatola Rotibi. Please wave to us as we recognize you. You're welcome, sir. Then the member of the board as well, Dr. Adeshola C. Odole. Dr. Odole, please wave to us. Thank you very much. The member of the board on ethics, the director of ethics, Dr. Naimeka P. Abanom. You're welcome, ma. We have the founding president in our midst. He is no other than Professor R.A. Adedoyin, the immediate past president of ACAPN. You're welcome, sir. And we are awaiting other BOT members, but we have in our midst Elder Adelo Woko as well. Elder Adelo Woko, please. You're welcome, sir. We quickly want to recognize the distinguished members of the National Executive Council. Wherever you are, just quickly wave your hands to us. Here we want to recognize Dr. Jubril Mohammed, the General Secretary. He's right there at the back of the hall. You're welcome, sir. We have in our midst the Treasurer, Piti Chioma Onuchuku. I believe she's at the corner outside there. We have also the Assistant General Secretary, Mr. Emmanuel Aliyu, is at the corner there, please wave to us. You're welcome, sir. And right beside me is the assistant PRO, Mrs. Ifoma Owosu. You're welcome, ma. And of course, we have, last but not the least, Mr. Ernest Anikwe is our national auditor. You are all welcome. We will be going quickly to the other items. And as we continue, we would recognize distinguished guests here present. But first, permit me to welcome to the podium for our welcome address the chairman of your state's ACAPN. Please put your hands together for our host chairman, Dr. Nse Odunaya. Please put your hands together for our host chairman, Dr. Nse Odunaya, please. Thank you.
Thank you very much. Professor Aderonke Akinpelu. Our guest lecturer for today, Professional Intercollaboration Exemplified, Professor Lighton Shoyonwo. My president, popularly called Golden Packager, our president for ACAPN, I salute you. Ladies and gentlemen, distinguished men of the press, it gives me honor and pleasure to welcome you to the 6th annual conference of Association of Clinical and Academic Physiotherapists of Nigeria, TACT Oluyole 2022. It is interesting to know that this conference is holding in a peseta state in its capital city, Ibadan, which is the largest city in West Africa, second to Cairo in Africa. The ancient city is enriched with beautiful cultural heritage and traditions, historic monuments and structures, which earn it the name Peseta State. It is also heartwarming to know that the first and the best university in Nigeria and West Africa is located in this city. The first and the best teaching hospital in West Africa is located in this same city. This city houses the best of scholars. I listened to the introduction. The first female provost of the College of Medicine. Great scientists, researchers, great men, great women are all in this city. Researchers and healthcare professionals of repute who have made global impacts, some of our participants will get to meet even for the first time and will get to collaborate with them. The conference with unique theme, healthcare dynamics in Nigeria, the patients, the physiotherapists, and the public is very central to us. Our decision to involve all stakeholders of healthcare profession in this conference is going to make history. This is an association that looks at what bothers Nigeria in healthcare system, and we want to try as much as possible to fix whatever we can fix. That is the basis for the theme of this conference. I guarantee you, as the chairperson of Oyo State chapter, that all has been put in place professionally, academically, and physically, with even interesting visits, tours, and pleasure rides for you to have the best ever at Physiotherapy Conference in Nigeria. I'm sure you are prepared physically and mentally to enjoy every minute you spend with us in the ancient city of Ibadan. The city is ancient, but the people are on point. They are real people and are ready to do all that they have to do to make us enjoy our time. Ladies and gentlemen, welcome to Oluyole 2022. Thank you.
Put your hands together for our Oyo State Chair, ACAPN. Without further ado, I also want to recognize the head of Chotsi, Dr. Abiola Cole. Please put your, Ma, you can wave to us wherever you are, Ma. The chairman, Ogun State Chapter of the Spinal Cord Association of Nigeria, Mr. Ayo Awombo. Please. Awombo. Please. Awombo, no. Okay. Sorry, pardon me. The chairman, Ogun State Chapter of the Spinal Cord Association of Nigeria, Mr. Ayo Awombo. Please pardon me, sir. Hope I've not murdered your name. Members of Medical and Dental Consultants of Nigeria here present. Without further ado, please, with a round of applause, welcome to the podium the Chairman, LOC, Dr. Adesola C. Odole. Please keep clapping. Clapping. Thank you. Thank you. Thank you, Mr. Chairman, sir. Please permit me to extend courtesies as laid down by Dr. Use Odunaya. Thank you. It is with great pleasure and utmost sense of dedication that I, on behalf of the members of the core Oyo State Association of Clinical and Academic Physiotherapies of Nigeria, Local Organizing Council, and the expanded LOC, welcome all attendees, inclusive of professionals, patients, and the public, who transcend diversities of age, status, and position to the ancient city of Ibadan in Nigeria for Oluyole 2022. This year's conference is tagged Healthcare System Dynamics in Nigeria, the patients, the physiotherapists, and the public. According to the 2009 communique of the Nigeria National Health Conference, healthcare system remains weak, as evidenced by lack of coordination, fragmentation of services, dearth of resources, inequity in resource distribution, and access to care. 13 years after this communique, the story appears not to have changed. This further outlines the lack of clarity of roles and responsibilities among the different levels of government. These and more are the burning issues of interest at Oluyole 2022. Oluyole 2022 is emphatically, I'm saying this with all emphasis, a memorable event owing to the superb quality, in-depth richness, undeniable expertise, and towering wealth of experience of all our speakers. I'm sure you know that, with Professor Olaitan Soyonwo and Professor Aderonke Akipelu being our speakers for this opening ceremony. The pre-conference workshops too, the panel discussion, and of course, special mention of the class of papers that we presented at the scientific sessions. Sincerely, ladies and gentlemen, planning for this conference was an Herculean task. Despite the fears and worries, we have made it. I am grateful for the support from the National Executive Council, Board of Trustees, Conference and Internationalization Council, Scientific Council, and the expanded LOC. And I want to show my appreciation at this point in time to the University of Ibadan Management, the College of Medicine, University of Ibadan Management, the UCH Management for their immeasurable support towards the success of what we are seeing today. I appreciate the dynamism, the dedication, and resilience of the members of the core OY ACAPN LOC members. Please, core OY ACAPN LOC members, let me see you wave your hands, please. Dr. Odunaya, Mr. Ernest, Professor Adegoke, Mr. Shaolin, Mr. Woniyi, thank you so much. I, with all sense of sincerity, thank God for bringing us together to serve our noble association. This conference will not be successful without the contributions of all the planners, donors, the supporters, the conference registrants, the colleagues and students that are here, and this wonderful audience. I thank you all for the support. Only God can repay your deed. Colleagues, ladies and gentlemen, this conference is not just about the scientific activity. You are enjoying to please enjoy the collaborations, the networking, the leisure activities, and meals. Oluyole 2022 is the home of Amala, Begiri, and Ewedu, with mouth-watering ogufe and well-cooked pomo, immersed in obeata. Trust me, I'm an evidence-based taster. Relax and socialize with colleagues and peers. You are warmly welcome to a professional family gathering at the Hilltop City. As usual, my arms are outstretched for hugs and molar-to-molar smiles. Thank you, everybody. Thank you.
Can you put our hands together for the LOC chair, please? We'll now invite, because of time, the president of ACAPN to please give us the presidential speech as we get ready to take the opening speech, opening address from the chairman. Let's put our hands together for the president, Dr. UAC Okafor, for the president's speech. Keep clapping, please. Keep clapping. Thank you.
Thank you very much. Good morning, the chairman of the occasion. Good morning, the Honorable Commissioner for Health, Oyo State, ably represented. All our guest speaker, our keynote speaker. Good morning, the chairman and members of the Board of Trustees, the NEC, our distinguished guests, colleagues, students. Good morning, all. My job is very simple, but to welcome our guests formally to this event. I want to welcome all of us to this very colorful 6th conference of ACAPN. And so it's my pleasure to welcome you, our dear guests, colleagues, and students to this occasion. ACAPN is a professional association of physiotherapists in Nigeria, in academics, research, sports, private practice, policy, administration, and others. And we take pleasure in mentoring students. And that's why we have amongst us today students from various universities. The event that led to the birth of our association in 2016 brought to the fore the mission to promote professionalism and integrity in physiotherapy and practice with a view to enhancing accountability, altruism, care, excellence, and social responsibility among physiotherapy professionals in Nigeria. Physiotherapy in Nigeria dates back to 1945 when two British chartered physiotherapists were engaged by the Nigerian government to render physiotherapy services at the now National Orthopedic Hospital, Igbobi, during the ending of the Second World War. And since then, Nigeria has continued to evolve in terms of physiotherapy practice. Today, physiotherapy in Nigeria has joined the global trend in the expansion of its curriculum from previously 3 years diploma to 4 years Bachelor of Science to 5 years Bachelor of Physiotherapy, and now to 6 years Doctor of Physiotherapy degree program. Likewise, physiotherapy training in Nigeria has maintained a leading role in Africa and has emerged from the pioneering role of University of Ibadan, the great UI. I expected to hear something. The great UI. Oh yeah, so you see the choice of coming to Ibadan is not a mistake. We decided to come back to the roots where physiotherapy training started in Nigeria and by extension in Africa. And so from University of Ibadan to University of Lagos to University of Oluyole University to University of Nigeria Enugu campus, and these are regarded as the first generation physiotherapy programs universities in Nigeria. Then later it moved to Bayero University, University Kano, Nnamdi Azikiwe University, Nnewi, and University of Maiduguri. We refer to them as second generation universities training. Today, we have a third generation of physiotherapy training programs, which has included universities of Benin, Bowen University, Iwo, University of Ilorin, University of Medical Sciences, Ondo, University of Calabar, Redeemers University, and Christland University, amongst others. Mr. Chairman, I'm glad to present to you, we have students from these different generations of universities represented here. Great Nigerian students, are you here? Students from University of Benin, are you here? Okay, University of Medical Sciences. Good. University of Lagos. Okay. Nnamdi Azikiwe University. Answer your names now, you're there. Okay. University of Nigeria Enugu campus. Okay, good. We have students from all these universities represented here this morning. For the first time, we have the honor of hosting our national conference at the ancient city of Ibadan. Therefore, Oluyole 2022 is strategic in many ways and connotes the historic commencement of physiotherapy training in Nigeria at the University of Ibadan in 1966. This conference, with the theme of great national relevance, the theme is healthcare system dynamics in Nigeria, the patient, the physiotherapist, and the public. And this is creating an avenue of awareness amongst the different healthcare providers and the core of patient delivery, and that's the patient. And that stipulated the essence of this theme. And so the public comes with greatly packaged academic content, glamour, and funfair. And so after this, we're going to go to plenary sessions where we're going to deal more on this topic. I have the pleasure to welcome our special guest of honor, the Honorable Commissioner of Health, ably represented by the Permanent Secretary, Dr. Soji Adeyanju, ably representing the Commissioner of Health. We thank you, sir, for making time to come. And of course, we have our chairman, the Vice Chancellor, University of Ibadan, Professor Kayode Adebowale, ably represented by our dear special woman, the first female provost of the College of Medicine of the first university in Nigeria, the University of Ibadan, in the person of Professor Olayinka Omigboju. Thank you very much for finding time out of your many programs to be with us today. I wouldn't tell you more, but I can tell you a little that she's a passionate friend and of physiotherapy. The day we visited her, she spent the first 30 minutes eulogizing physiotherapy, telling us more than we know about physiotherapy and how productive and how impactful physiotherapy has been in her life and in her practice as the provost of the College of Medicine, University of Ibadan. Thank you very much, ma'am. We also acknowledge, in absentia, the deputy provost of the College of Medicine, University of Ibadan, one of our best brains in physiotherapy. Put your hands together for Professor A.F. Adeni. He's not here today, but I can tell you that apart from University of Lagos, where we have once had a deputy provost of College of Medicine who is a physiotherapist. University of Lagos, we always set the pace sometimes for University of Ibadan to follow. Thank you, sir. Thank you. When I finished, I dropped the microphone. You pardon me. Now, University of Ibadan is the second university in Nigeria where we have a physiotherapist serving as the deputy provost of the college. And University of Ibadan too has been the only university in Nigeria where we had a physiotherapist that served as the deputy vice chancellor in the person of our professional mommy, Professor Ariola Sonya, who is on avoidably absent day. And so University of Ibadan physiotherapy has come a long way. He was also a commissioner of health in Oyo State, the same Professor Sonya. Oyo State has always also produced our grandfather in the profession, the person of Mr. Christopher Ajao, who was the first commissioner in Oyo State, a physiotherapist. Put your hands together for physiotherapists in Oyo State. I want to thank all other guests that have made out their time to be with us today. A core competency for ACAPN is professionalism, integrity, and mentorship to both our younger physiotherapists and students alike. Our Students and Youth Directorate has shown such record-breaking innovations over the years. And I particularly recognize my friend, Director of Youth, Professor Kayode Oke, for the great job you have done in mobilizing the youths. Thank you very much. And so the Director of ACAPN Consortium and also Directorate, the Director, Dr. Eti Onigbinde, for organizing the fellowship programs in ACAPN, for which we have various people, professionals who have come to take the course. And today they are recognized as fellows in leadership and mentorship in physiotherapy. Finally, the chairman, Ma, I want to appreciate our distinguished guests, the chairman and members of ACAPN Board of Trustees, led by our own Professor BOA Adegoke, the NEC, the chairman and directors of ACAPN councils, chairman of state chapters and specialty groups, and the entire ACAPN membership, and of course, our students, for your love and support since my election as the president of ACAPN in March 2021. I appreciate members of the Nigeria Society of Physiotherapy, our sister professional body, and of course, other professional associations, the Nurses and Midwives Association, the pharmacists, the Nigeria Medical Association, and all others for making time to come to join us this morning. I want to thank you all for honoring our invitation, and you have made us indeed proud. Thank you very much.
Thank you very much, Mr. President. And may we now invite the chairman of the occasion to do two things. In fact, three things. I want to get her attention first. Okay. As the chairman of the occasion, she will give the chairman's opening speech. Then, as the provost of the College of Medicine, she will give a goodwill message. And as the chairman of the occasion, he will declare the conference open. So she's going to be doing three things at the same time. Can we put our hands together for the Vice Chancellor of the University of Ibadan, here represented by the Provost, Professor Olayinka Omigodun, Professor of Child and Adolescent Psychiatry. Please put your hands together for the chairman. You're welcome, ma'am.
I start off with this wonderful quote, and I say, "This is the day that the Lord has made." Let us rejoice and be glad in it. We are all here, we are alive, we are healthy, there's peace. We were able to enter. We're not living in an area of strife. We've been able to gather from all over the nation to come to this place. And of course, despite all the difficulties, salaries, no salaries for many of us for the last 8 months, so many difficulties, we're still able to put something together and host this wonderful, wonderful, wonderful conference. I think we should all congratulate ourselves. I'm very privileged to be representing the Vice Chancellor of the first and the best, and I'm so happy that our President acknowledged it. There's 2 universities in Nigeria, University of Ibadan and the others. Well, let me say something, President, and then I'll take my protocols. In the current ranking, we have to be careful. I was looking at the World University rankings recently, and actually, Ibadan is number 1 still. We have to be careful. Number 2 is Lagos. Number 3 is Covenant University. Yeah. So what has happened is that Covenant, which is 20 years old, is approaching far to a University of Ibadan, which is what? Over 70, and you are 60. Yeah. It has overtaken many of the, what we call the first generation universities, ABU, Obafemi Awolowo, and that's a university of 20 years. You are academic physiotherapists. We need to take heed. It sends a strong message. And before I continue, when you now look at the subject areas, when you break down subject areas, it's important. Information is power. You find that Ibadan is still top in medicine, healthcare, physiotherapy, healthcare, and education. Whereas Covenant University is number 1 in the country in engineering, number 1 in the country in social sciences, number 1 in the country in physical sciences. Yeah. You are clapping for Covenant. No, it's a problem. I like Covenant University, but it's sending us a strong message. All of us, I don't know if there are any people here from Covenant University, but it's showing that number 1, it has a positive message that in a very short time, you can do a lot to improve the ranking of a university if there's a will. When there's a will, there's a way. That's the first message. The second message is that the fact that you are old and you've been there for a long time doesn't mean you are going to be there always. That if you don't improve yourself and keep looking at how to improve, you will find that people will come from behind and they will take you and you become irrelevant. It's a very strong message to us. In societies where they understand the importance of heritage and history and excellence, they protect their best. You find that constantly Oxford, Cambridge are the top. You find that Harvard is always at the top. Yes. So this is a very important signal to us that we are going through a transformation, and a transformation is not new. Because many of us went to public secondary schools, at least in my generation. You all went to private secondary school, right? Yeah. In my time, in secondary school, you don't go to a private school, you go to government school. I beg your pardon? There were a few. There were a few. But in my time, we all went. But then, at a point, the government said they were taking over. I won't call my school a private. My school was a mission school. I went to St. Louis Grammar School, Mokola, Ibadan. Oh, yes. It was a beautiful school. We were 300 girls. And we were looked after by nuns and teachers. We were only 30 in a class, and every set had only 2 sets. Now, in that same school, there are 3,000 girls. 300 in the same facility. So just to tell us, and I did not send my own daughter there. So it's a message that, and I think because physiotherapists are the core of the nation, I think it's important that we know that we need to guard our heritage. So, the Vice Chancellor in absentia, I must acknowledge him, Professor Kayode Adebowale, MMI, FAS. The Chief Medical Director, Professor Jesse Otegbayo, of also the first and best teaching hospital. But then I also know, I know what UCH was like. I was born in UCH. And my mother told me they were changing her bed sheets ever so often, about 2 or 3 times a day. And that everywhere was beautiful and sparkling clean. Yes. Ably represented by Dr. Barrow Michael, DCMAC. There's a board meeting going on, so the CMD is there and they've been calling me. I'm supposed to be there, but I have to take the directive of my Vice Chancellor and be here. The Commissioner for Health, also a distinguished alumnus of the College of Medicine, ably represented by another distinguished alumnus, Dr. Adeyanju, who has some indirect links to me. Your wife has done some mental health. She's a distinguished nurse. The president of the Association of Clinical and Academic Physiotherapists in Nigeria. I was told that his name is Packaging in Gold. Packaging in what? Gold. Did I get it? I'm redoing it now. Packaging in what? They say anything you give him to do in his hands, even if it's something simple, by the time he has worked on it, it becomes gold. It becomes gold. Wonderful. That is such an awesome declaration over your life. And I know people, you would always attract people. I noticed when you were coming up, we were getting small claps, but your own clap was the loudest by far. Our keynote speaker from the great family of Olobado in Oshogbo land, my Yaoko, Professor Aderonke Akinpelu. I'm always happy to see her. She's my husband. I don't know, for those of us in Yoruba, you understand. So before I leave this place, she's going to give me money. Watch it. You watch and see. She's going to give me money. But what currency are you going to give me? But I must say she's a wonderful, beautiful person. Right? Ever since I stepped, I can't tell you the long story because of time, but ever since I stepped into their home, their family, she has always been there for me, looking after me, encouraging me, and making sure my knees and my bones are working well. God bless you. My teacher, a wonderful, great palliative physician, one of the leaders in the world in palliative medicine, a professor of anesthesia, Professor Olaiton Shonyowo. It says, in old age you will flourish. And you're actually doing new things. Even after you have retired. You have not retired, you just moved into a new city. Creating new programs, new services, new systems. And that is God's promise to us and to you, that you will continue to flourish. and flourish and flourish. Thank you so much for all you are doing. I must also acknowledge the chair of Oyo, the association, our ceremonial chair, Dr. Unse Odunaya. God bless you for all you're doing. You're also the ceremonial chair in the College of Medicine. I appreciate you. And also the chair of the LOC, Dr. Adeshola Odole, who is also the chairperson of the college e-learning committee. I really appreciate all of you. I hope I've not missed anybody else, but I just want to say, ladies and gentlemen, I can see so many wonderful people. You are blessed and we appreciate you. Thank you for taking time out to come. And then I acknowledge in absentia the Deputy Provost of the College, who works very closely with me, Professor Ade Fatai Adeni. I must acknowledge him. I'm surrounded by so many fantastic physiotherapists, and I've always seen them. They are diligent, determined, institution builders, and they are wonderful people. And I'm sure all of us here are wonderful people. I will briefly, the Vice Chancellor called me and asked me just a few, not so long ago, to represent him. And I said to him, sir, what do you want me to say on your behalf? First of all, he says he extends his congratulations and his good wishes, and he wishes you well. He says that he's going to do all he can to support your therapy. He says that he recognizes the need for you to expand, and so he's going to support your expansion, your system growth, and your human resource growth. And that he knows that you are a valuable resource in the University of Ibadan, and that he's going to continue to work in partnership and synergy with you to make the University of Ibadan greater and greater and greater. And then I decided to add a bit to the message of the VC. And I want to adjust the title of the theme of this conference just a little. I would say healthcare system dynamics in Nigeria, the patient, the physiotherapist, the public, and all of this politics. In politics. You cannot talk about dealing with the patient, dealing with the physiotherapist and the public. It all depends on your impact and your influence in politics. You are at the core of our nation's well-being. By virtue of being physiotherapists, you are the core. By virtue of what you do, you are people who promote well-being. So the first question I ask you, how much does this nation feel your impact as physiotherapists? If you are truly at the core of well-being, how far has your message of well-being gone? Do they hear it in Aso Rock? Do they hear it in all the state capitals? Are they hearing your well-being message of exercise and physiotherapy and rehabilitation? Are they hearing it in our schools? Are they hearing it even in our hospitals and in our primary care settings? You are at the core of this nation's well-being. How far have you taken your message? That's the first question I have for you. It's nice for you to gather as clinical and academic physicians and physiotherapists, but is your message going out to every highway and byway of this nation? Are you bringing transformation through policy and politics? Or are you sitting in the comfort of your offices and your clinics and thinking that transformation will come whether you are there or not? The time of comfort, the time of sitting in clinics and in your offices has ended. If we sit back and think that transformation is going to come, then we're making a big mistake. We have to get it We have to go out and take our message. And sometimes we have to be quite forceful in ensuring that that message gets everywhere in this nation. And that is why you need to position yourself for politics. In politics, some of you need to be strategic in your planning, strategic in your thinking, and always have people that will be there at the decision making of this nation to make sure that you are carried along and your message of well-being goes. As a psychiatrist, I understand very fully the importance of a physiotherapist. In fact, I understand the importance of the healthcare team. I know that as a physician, I need to work in a team. And every member of the team has something excellent to contribute. And there must be mutual respect and understanding. I recognize that the nurses, the physiotherapists, the laboratory scientists, and every member, the occupational therapist, the special educationist, all of us need to come together and work together as one big block so that our healthcare delivery can have great impact in this nation. I suspect that one of the reasons, amongst others, why we may be having a mass exodus is because we are fighting ourselves. You are talking about the theme, healthcare system dynamics. You know, when you're busy fighting, then the other people just kick you around. And then we're having what now? But when we are together as healthcare professionals, then we are unstoppable, we are unbreakable, and we are unbendable. Because ultimately, the aim is to have what? Excellent healthcare delivery. Right now, there's a massive immigration of the best of the best. Everybody wants to leave Nigeria. Everybody. I don't want to leave. I don't. Well, so maybe other people. I don't know. Do you want to leave? They're not leaving. Particularly the young people. We are training for export. It's a disaster. All of you, you are not going. You're staying with us. But the rest, the other two are leaving. It's a disaster. And you see, it's like you have nurtured, you have developed, you've looked after your children, and when the time comes for them to bring forth, they are nowhere to be found. They are serving as slaves to another man. Yeah. Because the truth is that they will walk you like a jackass. You walk and walk and walk and walk and walk. And honestly, by the time you get your salary, and then they take a third of it for taxes, then it's like a vicious cycle trap. Massive immigration of our youth. Who's going to look after us in our old age? And we're all comfortable with ourselves. But you know, some of them don't want to leave. But there's a problem. I was told that when you now want to open a job space in the university, you have to go to the head of service in Abuja to ask for the space. And it's not just one trip. You'll be going and coming, then you have to defend it in men. I want to employ staff in UCH or in the college. I have to be going to Abuja about 100 times. That employment now is taking place in Abuja in a nation of 200 million people. And we are all comfortable. That's a disaster. That's a disaster. Because we've lost focus. In world-class universities, if I want to employ and identify a very brilliant person, I should have the opportunity to make an informed decision as a leader. But now you have to go. So what's going on now is that our people are finishing, the therapists, doctors, they look for jobs. It takes 2 years for Abuja to open a position. So in the interim, what do you do? What do? You leave. That's a disaster upon us. For as long as decisions are being made in Abuja in the periphery, then we're going to have a massive influx. And I think those are some of the things we need to speak about. I also want to mention, you are academic physiotherapists. Research is at your core. Not research that will sit in the office, but research that will become what? Policy and practice. But another major problem now is that as an academic, if I get a research grant, I work very hard. The American government gives me research money. You know where the money is? Central Bank of Nigeria, CSA. Central Bank. So all my research grants are in the where? Central Bank. And this affects all of us, so we can't keep quiet. So when I want to access my money, it can take me up to a year because they are looking for the money. They'll be looking for the money. In the meantime, my funder has given me a timeline to execute. And when I don't find the money during the timeline, they will withdraw their money. So there are deep, deep problems of over-centralization in this nation that we need to talk about. Finally, I said you are at the core of our nation's well-being, promoting health, physical health, mental health. I'm a psychiatrist, but there's a very close link between exercise and mental health. Many studies show that using physical exercise alone can manage depression, and that if you want to maintain good health, you should exercise regularly, and so on. Right now, there's a lot of stress, and that exercise is a very good stress reduction exercise. There's so much stress in Nigeria. No money, inflation. What are you doing to reduce the stress of this nation? As an organization, as academics and clinical physiotherapists, what are you doing? What message are you telling the president of this nation and the governors about stress reduction? Is it loud enough? I think that as you meet, I don't know the exact lectures, but I think it's important that there must be a very strong communique, and it must be really loud about the suffering of people in this nation and the role that you can play to make sure that things change. And most importantly, get involved in politics. Get involved in policy. Let us work together as a team, healthcare team, to make sure that we save our nation from the current downfall that we're experiencing. Thank you very much for the attention. So on behalf of the Vice Chancellor who I'm representing, I'm very, very delighted. I'm honored to hereby declare Oluyole 2022, the 6th Scientific Conference, an annual general meeting on the 10th to 15th October 2022, themed Healthcare System Dynamics in Nigeria, the patient, the physiotherapist, and the public, all in politics. I hereby declare it open and ask that the blessing of God will rest upon every aspect of our deliberations, that it shall be a time of friendship, it shall be a time of sharing, it shall be a time of caring, it shall be a time of joy, that all of you will enjoy Ibadan, and that you will all go back home happy and fulfilled. And indeed, you will bring change to the nation we love. Thank you very much.
Please keep clapping for the chairman. I think she has given us an overdose. Thank you so much, ma. We are grateful. And I'm sure we all heard what she said that will happen after this conference with the Department of Physiotherapy in University of Ibadan and in UCH. Thank you very much, ma'am. And quickly we want to move on to, because of our time, to the keynote speech. Ideally, we are supposed to have the citation of the keynote speaker. But Professor Aderonke Akinpelu has said, because of time, we should open to page 20 of our brochure. Page 20 of your brochure, the second information, the profile, our profile. So she has excused us to read our citation because of time. May we put our hands together as we make welcome Professor Aderonke Akinpelu.
Vice Chancellor of the University of Ibadan, and the Provost of the College of Medicine, University of Ibadan, Professor Oluyole Omibodun, the Commissioner for Health for your state, the Chief Medical Director of the University College Hospital Ibadan, the President of ACAPN, the Chairman of the Board of Trustees of ACAPN, the Head of Physiotherapy Services in Oyo State, and last but not the least, my mentor in the field of pain, a very humble and quiet achiever, a woman who conceived and gave birth to two multidisciplinary societies in Nigeria, the Society for the Study of Pain and the Society for Hospice and Palliative Care. I acknowledge you, ma. I would have left the field of pain, but she would not allow me to go. I want to thank the chairman and LOC members of the LOC of Oluyole 2022 for inviting me to give this keynote address. I wish I could say ditto to the chairman's opening address because she has covered a lot of what I want to say today, and I just sit down. But all the same, I have to give my address. I have titled my lecture, Nigeria Physiotherapists in an Ever-Changing Healthcare System. The healthcare system all over the world is ever-changing, never static. And the healthcare system is a complex organization of people, institutions, and resources that deliver healthcare services to meet the health needs of target populations. The focus of the healthcare system, the patient. Now, before we discuss the changes that have occurred in the healthcare system of Nigeria, I think it is wise to discuss some of the changes that have occurred outside Nigeria, that is in the world. The changes that have occurred in the Western healthcare system have been captured in three eras. The era of expansion between 1920 and 1960, when hospitals many hospitals were built all over the world. There was also increase in technology and so on. The expansion was much. Then came the era of containment. Because of recession at that time, between 1960s and 1980, the questions were raised. Are we continuing in this way? No. We have to limit the rate of expansion. And then, lastly, the era of accountability. And this is the era we are now. And the questions arose. What works? What does not work? If you want your hospital to acquire an instrument that costs 3 million naira, the authority of the hospital will ask you, what will it add to the healthcare system? How long will it take for the hospital to recover the 3 million and so on? So it is a period of accountability, and many things, many changes have occurred and they continue to occur at this period. Let's look at some of them. During this period of accountability, there has been increased demand for evidence of treatment effectiveness. And this is more so in physiotherapy. We have had to drop some of our modalities, some of our modalities, because there has not been enough evidence to back them up. And many drugs were replaced by new ones in order to ensure that there is effectiveness in what we're doing. This is a period also when there was increase, or it's still occurring, there's increase in the use of scales to measure abstract aspects of health. Pain, for instance, there's no instrument for pain, there's no physical instrument. The person will have to express the feeling of pain. Then the disability cannot be measured by any physical instrument. So this is a period when there has been proliferation of what we call paper and pencil scales, questionnaires that are used to measure some aspects of pain, some health attributes that cannot be measured by physical instruments, but that are important to patients. Quality of life, for instance, even patient satisfaction, and so on. Then evidence-based practice developed. And then many libraries sprang up, the Cochrane Library, systematic review, and so on. And even Pedro, the physiotherapy-based database for evidence-based practice, and so on. Then, during this period, outside Nigeria, I must say, there has been increased collaboration between different healthcare professions and teamwork, working together. And this has led to what is called triage, when patients will come to a hospital center and advanced practitioners in nursing will sort the patient out that, okay, you go to physiotherapy, you need surgery, you go to clinical psychology, and so on. So there has been a lot of collaboration and teamwork. I want you to think of how much collaboration we have in Nigeria. Then We have moved on now to telehealth, in which your patient can consult you from a distance. And I want to appreciate Dr. Odole in this area for telephysiotherapy in Nigeria. Then the outside world there has moved on to digital health records and networking. When you go outside Nigeria, you won't see healthcare professionals writing on papers again. It is about using computer and apps. And then it is during this period too that the international classification for functioning disability and health was developed. And it was in, I think, 2001 that the final document was produced. It started as ICIDH, and then there were changes that led to its current name. And I want to say that the ICF is so important to physiotherapy because it classifies the consequences of disease, which the WHO realized was not covered by the ICD. Now, what has led to all this in the healthcare system in the world? I want to say that it has been a paradigm shift of moving from physician or healthcare professional-centered care to patient-centered care. So the patient is always in the center, and healthcare providers will have to contribute to the care of the patient to make the care optimal. Now let's talk a bit about the elements of patient-centered care. It includes respect, and the respect is not about good morning, sir, good morning, ma. It's about respect for the values and treatment preferences of the patient. And the patient cannot make choices unless he knows the options. So it's also important that we communicate the diagnosis, the prognosis, the treatment process, the self-care, the progress, and all aspects of care to the patient. That is what is done in the West. Then there's the need to coordinate the care. Oh, this patient needs, yes, the medical care, yes, but then physiotherapy is needed, occupational therapy is needed, the social worker has to perform his or her role, and so on. So there's need to coordinate all aspects of the care. This is what patient-centered care is about. Then information. Providing information for the patient, I have said that, and information about resources. In the West there, if a patient comes for surgery at a center, the follow-up could be done in a nearby facility close to where the patient lives. Provide information about the medication you are giving to the patient. There was a time my doctor consulted a doctor in the clinic, and she asked, so what is wrong with me, and why are you giving me this drug? The young doctor was shocked. Said, my mother will not take it from me because I warned her before she left. And it is even worse in physiotherapy. We don't communicate well with our patients. We don't give enough information. The patient you have asked to raise up the hand 10 times, morning, evening. If you don't explain what that would contribute to the recovery of the patient might not do it. So we need to learn. Comfort, very important. And this is about treating pain. We have to treat pain. We have to provide conducive hospital environment. And we must work to make the patient less anxious. The system in which a patient will be told your surgery will be tomorrow, and then we come back and tell the patient, no, it cannot, you can't have your surgery today, and then the next 2 days, the patient is still on admission, is not the best. But where patient-centered care is, everything has been taken care of. Then transitioned to independence. This involves making plans for a patient who has been on admission to go back home, especially patients who have long-term disability. Wonder what do we do to victims of spinal cord injury when we're about to discharge them? Where I worked outside this country, before a patient with spinal cord injury is discharged, the physiotherapist, the occupational therapist, and the medical social worker will go to the house of that person. We advise the family on changes that they have to do before the patient is discharged home. We have to learn this. Some patients are discharged and they don't have any idea how long they will take medication for and so on. We must assist them, and this transition must be to make them as independent as possible. Now, changes in healthcare systems specific to physiotherapy profession and practice. In the 1960s, 1960s, and even part of 1970s, the entry-level qualification of the average physiotherapy was a diploma. But now it is a first degree in most places. And then we now have postgraduate training programs in physiotherapy with areas of specialization in Nigeria and outside Nigeria. There are also postgraduate clinical trainings, First contact practice, that's a direct access to physiotherapy services, is well established in many countries, and it is legislated. In Nigeria, this is yet to be achieved. System-based practice guidelines have been developed for many conditions that are treated by physiotherapists. In the UK and many other countries, physiotherapists are trained as advanced clinical practitioners to enable them perform a lot of functions to see patients directly, to practice direct access to physiotherapy. And in the UK, they are even allowed to prescribe some drugs, at least I'm sure in the area of musculoskeletal physiotherapy. And when I was preparing for this lecture, I had to interview some of the products of my department who are in diaspora, and one of them told me, Ma, a few of the advanced clinical practitioners in physiotherapy have also trained in pain medicine and are now working as pain advanced clinical practitioners. So they give pain intervention like pain physicians. In the United States of America, the primary health care physiotherapy has been inculcated into the first degree program, and the degree has changed from bachelor degree in physiotherapy to first degree to DPT, that is Doctor of Physiotherapy degree program. So to what extent have these changes occurred in the Nigerian healthcare system? I would say to a very small extent. Please permit me to express my opinion. I would say that in Nigeria, our healthcare is essentially healthcare professional centered. Collaboration and teamwork in patient care among healthcare professionals is very poor. Like we fragmentized care. The doctor does his own part, the physiotherapist does his part, and so on, but there's no collaboration. Even for ward round, don't find professionals coming together to discuss patients in many settings. You can have one or two centers where this occurs, but it is not very common. Communication with and respect for patients are very poor. We don't communicate well with our patients. Evidence-based practice has not been well embraced, especially among physiotherapists in Nigeria. I'm sure there are centers where they still use infrared radiation. This is rather unfortunate. There is absolutely no evidence for this. The use of outcome measures, which is so important to us, which provided evidence of effectiveness of physiotherapy in the West, which led to the survival of physiotherapy as a profession, has not been embraced by us. Some years ago, we conducted a study to find out about knowledge, familiarity, and awareness of outcome measures among physiotherapists, and the conclusion was that all of them were very low. 10 years later, we performed the same survey. The awareness, the familiarity has improved, but the utilization is still very low. And because of this, the evaluation of abstract health attributes that cannot be measured by laboratory investigations of physical instruments to provide evidence of treatment is still poor. Triage is not part of our clinical practice. Digital health record keeping still rudimentary in Nigeria. Telehealth is at its stage of development. Our telecommunication system does not even enhance that. The ICF has not been embraced by rehabilitation therapists in Nigeria, including physiotherapists. And this is the basis of our care. Then the next question, are there no positive changes in the Nigerian healthcare system? All I have said before now are negative things. Yes, there have been positive changes. Poliomyelitis has been eradicated. Thank God to vaccination. When I was a student here in UI, the Yoruba name for physiotherapists was Komori, those who teach children to walk. because there were so many victims of poliomyelitis needing physiotherapy. Then, when I was a student, diagnostic imaging was limited to X-ray, that is radiographs. But today we have CT scan, we have MRI, and so on. Even ultrasound scan. And then surgery has improved very much. When I was a student, you will work on a woman who has had cesarean section for a week before she can stand upright, because the incision was vertical. Now we have the skinny incision that is horizontal and makes it the same day the woman gets up. Okay? But we still have a lot to go do. Anyway, let me talk only about the positive side. Cancer management has improved as we have radiation therapy and chemotherapy. I remember that UCH employed 2 radiation therapists, and they were left one by one out of frustration because they had no instrument to work with. Now we have many surgeons who perform total arthroplasty for the management of severe osteoarthritis, any of the arthritis. Now, let's look at issues with our healthcare system in Nigeria. Poor health facilities. I have discussed a bit of this. Emergency health services in Nigeria are deficient. I don't know who you can call and will bring helicopter to carry a patient who needs emergency services. And when you get to the hospital, how ready are those to receive them? Inadequate number of healthcare professionals in most settings. Last night I was reading the provost post and how she lamented in losing 2 of the psychiatrists that the department has trained because they couldn't get a job and they had to leave for the UK. I would say Japa is not making things better. The current exodus to the UK, to Canada especially. Primary healthcare services are no longer functioning effectively as they used to be when it was started by Professor Oluyole Ransom Kuti. And Teamwork is not in existence in most of our settings. Respect for and communication with patients by healthcare professionals, including physiotherapists, are very poor. Process of care places much stress on the informal caregiver. And this is one area we need to look at. When you have a patient on admission, at least I can speak for UCH, with due respect, sir. You have a patient, you are given a prescription, you go to a place to pay for it. You first of all go to pharmacy, they cost it, you pay. Some of them are not available. You get the ones you can get in the usage. You run to some pharmacies, shops there. By the time you come back, find another one asking you to go and pay for some investigations. You get investigations, and you have to go to the lab to get the material to collect the blood or whatever. And then before you come back, another person has written another set of drugs, prescription for drugs. It's very, very stressful. Very, very stressful. I think we need to look at things. And I'm going to touch on a very sensitive issue which remains controversial, and that is the change in headship of teaching hospitals from house governor to CMD. The question is, does this really has it improved the healthcare system? I don't know, but to me, it doesn't seem to promote collaboration among professionals. I may be wrong, because that was what led to some other professionals who do not have the strength of population to come together. We should not be fighting each other. Find unions fighting this and so on. No. Just a minute. Oh. Just a minute, please. Issues with physiotherapy healthcare. So if issue with Nigerian healthcare system specific to physiotherapy. Training programs to prepare physiotherapists for first contact practice are at its initial stages in Nigeria. Curricula for most physiotherapy training programs have not been revised for this purpose. In many hospitals, older physiotherapists tend to focus more on administration to the detriment of patient care. I think this must change. Physiotherapy internship is said to be deficient in structural organization, supervision, and it is clouded with negative experience. I'm not stating this from the blues. We conducted a study a few years ago. We had a focus group discussion with physiotherapists who have just completed their internship, and the conclusion of the study is what I have said. It is not enough to say an intern will go through this rotation and rotation. There are many other things. So, guidelines developed that is practice guideline, developed for the Nigerian clinical setting are not available. Physiotherapy assessment and interventions are not evidence-informed. If we accept that healthcare continues to change, you cannot use the knowledge that you had when you graduated 20 years ago to still continue to treat patients. One lady approached me some years ago and said, "Are you the one teaching outcomes assessment to University of Ibadan graduates?" I said, "Yes." Said they are always arrogant when they talk about outcomes assessment. And I questioned, "Why did you not teach me when I was in school?" And I said, "If I teach what I taught you now, then I'm not a good teacher." So we should change, should update knowledge always. We must accept and inculcate the ICF concept into our assessment data analysis. What are the impairments? What are the disability? That is activity limitations and participation restrictions. First contact practice is not well established in Nigeria. What is the role of physiotherapists in this ever-changing system? One, we must accept the fact that continuing professional development is our lifelong responsibility. No stopping of acquiring knowledge. Interns and young physiotherapists must be supervised by older physiotherapists. It is the professional responsibility. And I must say that I admire medical doctors for this. Please, we have to change. Internship must be seen as a continuation of training and we should not see interns as supplementing our workforce. We must train them. The Medical Rehabilitation Therapists Registration Board of Nigeria was pleased, and I think some of the members of the board are here, must provide organizational restructuring for the internship of physiotherapists in Nigeria. We must make effort to include outcome measures in our patient care because we need to evaluate. When you evaluate, you are able to see the time of discharge. We must accept ICF as the basis of analyzing our assessment data. We must learn to communicate with patients properly. We must embrace evidence-based practice, and it is easier now. Just go to Google and write Physiopedia, low back pain. We see all the guidelines there. And even Pedro is available, and it's a free database. We must work to provide, and I'm challenging the ACAPN to work to provide practice guidelines and environment. We can also produce patient assessment guides for different conditions or groups of conditions for uniformity. We must also work to provide feedback to other healthcare professionals and doctors. When they refer patients to you, you must give a feedback. And that enhances collaboration. By the time you do it 3-4 times, I'm sure the doctors will be interested and you'll collaborate better. Curriculum review by university-based therapy departments is a must because of the changes in physiotherapy curriculum. And we can also develop courses to prepare qualified physiotherapists for direct access practice. We have a responsibility to provide government, institutions, and the public about our profession. Adequate information. Some years ago, a cousin-in-law of mine came to my department and she said, I will say it in Yoruba, Sisi Ronke, ṣé ọ̀rọ̀ àwọn ọ̀rá náà ló fà gbogbo ibi? No, her physiotherapy is anonymous to massage. And I lied. She doesn't know. And many people out there don't know what physiotherapy is about. Yes, my conclusion is that there is a lot we can do as physiotherapists to drive the change we want to see in the healthcare system in Nigeria. Thank you very much.
Let's hear it louder for the keynote speaker. Thank you so much, Ma. And quickly, we want to transit to the final stage of this opening ceremony by taking what we have all been waiting for, the guest lecture. All right. I've been told to step down a citation. But quickly, I want to crave the indulgence of the BOT chair, standing in for the chairman of the occasion. Please ask our distinguished guests for this lecture, so that we can see the screen, that we should please reposition so that we can actually see the screen. Can we put our hands together for our distinguished guests as they take their seats on the tables? Just briefly, you will still come back, sir. You still come back to end the opening ceremony, to close the opening ceremony. Please keep clapping for them as they go. We also want to relocate the podium so that those of us here can see the screen, because this is the guest lecture. All right? So we'll move the podium there so that Mama can take the lecture from there. So please, IT, can we have someone move the podium for us? Thank you very much. All right. Can we just stand and stretch quickly? Mommy, what? Can we put our hands together for our guest lecturer, please? Can we have the podium here? All right, can we be on our feet? Prof said we should all be on our feet. So Prof, we are following Prof's instruction. Prof said we must stretch. We must stretch before she continues, okay? And then she said, according to a particular protocol. So Prof, with your permission, not aside Prof and maybe Professor Akipelu, can we spell coconut with our waist, please? All right? So when we say, let's do a C, you do that curve of a C, okay? Can we have a C? C, coconut. Let's have an O. Another C. Another O. Somebody is not spelling coconut there. Let's have an N. And a U. Finally, let's add a T. And now we've spelled coconut. Thank you very much. So for Prof's citation, you can move to page 20 of our brochure. So please, we'll be seeing Prof's slides on the screen while she takes the guest lecture. Just one more time, put your hands together for our guest lecturer. Thank you, ma. Professor Oluyole Soyanwo.
It's almost 1 p.m. now. And secondly, I saw packs being circulated. So it's difficult to be talking at this time to the audience when you are at this stage. And that's why I said that in this multidisciplinary gathering and interdisciplinary mode that we're in, that the physiotherapist should give us a few seconds of exercise before we start. Thank you very much, the MCs. Before I start, we've spent a long day, but I can't start without recognizing the doyens who are here this morning, the representative of VC, our darling Provost has left, but I know that we still have the representative of Oyo State government, and we are talking about Oluyole 2022. So Dr. Adeyanju, thank you very much for staying with us. Dr. Michael, call him that, representing our CMD, thank you very much. And all the council members of association, council members, executive, and leadership. And in this establishment, we always value our nurses. And I can see that we have a lot of our senior nurses in the audience. So thank you very much. My own topic is to talk about interprofessional collaboration in healthcare. And this is very, very important. I appreciate Dr. Odole for chasing after me to be here for this presentation.
I thought I was going to do it virtual, but somehow I'm happy that I'm able to be here with you today. That professional work, I'm going to talk about what healthcare should be like, healthcare team and the types of team that we run with. Then what is team function? And how do physiotherapists fit in as team players, and how do they function? And the issue of collaboration in healthcare. So healthcare can be defined as the improvement of health via prevention, diagnosis, treatment, amelioration of illnesses, and cure of diseases, illness, injury, and other physical and mental impairments. The provost is one of the doyens of interprofessional collaboration, because she actually, in this establishment, started the master's program for adolescent and childhood psychiatry. And in that area, there's a lot of interprofessional work. Healthcare is delivered by health professionals and those from allied healthcare. And when two or more health professionals work together in a coordinated, complementary fashion, and they have ways that they have agreed to provide quality, cost-effective, evidence-based care to patients, then you are talking about healthcare team. And teamwork involving multiple disciplines is increasingly being practiced in the world now, as Professor Akinpelu has also mentioned. It emphasizes the issue of health service, policy, education, and research. And of course, we're here today celebrating your society, which is society or association of not just physiotherapists that provide service. We also have physiotherapists that are in education, that are in policy, and those in academia. They are also doing a lot of research. Now, what are the type of health teams that operate in the system? You can have unidisciplinary, just as this association is an association of physiotherapists. And you have different levels and different grades with different skills, but you are all in the same profession. Then you have the multidisciplinary, where you have different disciplines, and each one has its own boundary. And as physiotherapists, you work with different ones. For example, you work with surgeons, you work with other therapists, like Professor Akinpelu mentioned, the occupational therapists, can be music therapists, depending on what you are treating, social workers, prosthesis. When you are talking about amputation rehabilitation, and even traditional healers can work with you when you are talking about rural areas. I know that in some countries, including Ghana and some countries in East Africa, these are also part of the traditional health team, depending on their laws and their guidelines. Then you can have interprofessional or interdisciplinary team. And these are people from two or more professions, including their subspecialties. For example, you can have surgeon, you can have urologists, orthopedics, and the different specialties. And just as physiotherapists, I know that you now subspecialize in these different areas. And the aim is to work with patients who have multiple physical and psychological needs. The intra-professional or intradisciplinary team are members from single disciplines who have different levels of training and skill. And we can also have the transdisciplinary, where you have different professionals moving beyond their disciplines. In cancer research, for example, you have healthcare professionals, and you also have scientists. You can have histopathologists, you can have physicists, and all these people come together for the sake of the patient. So in general, we are talking of team, and some of these terms can be used interchangeably. But when you talk about the multidisciplinary team, or the MDTs, they have mechanism for organizing and coordinating health and care services to meet the needs of individuals with complex needs. It's not necessarily when you have patients that have straightforward conditions. If you have a patient that has malaria, for example, you don't necessarily need a multidisciplinary team to look after that patient, because you can make a diagnosis and go straight to the treatment. But if you have a patient that has chronic back pain or has mental health issues, the story is different. But in general, the teams bring together the expertise and skills from their different professions. They plan and manage care jointly, and they're expected to work proactively to support individual care goals at all levels of healthcare. They also access a range of health, social care, and other community services with focus on keeping people well, independent, and without unnecessary hospital care. For the physiotherapists, the composition of the team, that is all those working together, is diverse, and it can be based in various settings. You can have a multi-layered model, as I've shown, and as Professor Kikelu mentioned, the center for the care is the patient, the caregivers, and the relations of the patients. For example, this model shows patients that need palliative care because they've had heart failure, and this has now become a chronic, debilitating illness. I know that some of you work with the neurological team. Some of you work with the obstetrics and gynae team. And some of you work with the oncology team. So in all these teams, you have the multi-layered level of health professionals, so that you can have the specialists close to the center, and then also to support them, you have the other groups of workers, like at the periphery, you can have them at the primary level, at the secondary level, and the tertiary level of care. Now, what about the role of the physiotherapist in healthcare team? Everybody that spoke from the high table this morning has alluded to the valuable work done by physiotherapists and as members of the team. Your contributions in terms of health promotion, health prevention, screening, as well as triage, assessment, and treatment activities are well known. And the academic physiotherapists combine service, teaching, and research. When I was asked to give this lecture, I was wondering what is the difference between the routine physiotherapists that we're all used to and the academic physiotherapists. Because I think that even those who are clinicians, they can also perform teaching and they can also perform research. But I don't want to dwell into how we split hairs in our own community, in Nigeria especially, because everybody is supposed to work together, and when lines are drawn, the lines should not be concrete lines. They should be drawn in such a way that we can all flow and give the best benefit to our profession, to our colleagues, and to our patients. Now, successful implementation of the multidisciplinary healthcare approach, among other things, depends on how we educate our students and the knowledge and roles of healthcare professions other than our own. I know that you have a lot of young colleagues in this audience this morning, so I'm going to focus a bit on that, because all my working life, I have worked with other professionals. I started as an anesthetist, and I moved on to pain medicine and later to palliative care. And I've been also involved in both service at hospital level, at community level, and also in administration. I've led departments, and I have also worked as a dean of clinical sciences. And just as you mentioned, that physiotherapists have been playing all those roles. I'm proud to say that when I was dean of clinical sciences, my sub-dean undergraduate was a physiotherapist, and that's Professor Kolapo Hamzat. And I think he's still in service. Yes. So it's a long time since, and that was around 2003. So it's quite some time since University of Ibadan has been playing that role and according physiotherapists their due role within the stream of. Now, as a member of the healthcare team, we know that physiotherapists have traditional roles in patient evaluation and treatment. And of course, physiotherapy work is not only limited to joints. As we have been told, we know that there's so many. As an anesthetist, I value the role of physiotherapists in respiratory care and also in neuro care, because if you put somebody to sleep and you cannot wake that person up, then your job has been futile. So, and we do work together. But many healthcare professionals are unaware that physiotherapists can actually practice on first contact basis and also autonomously. Professor Akinpelu mentioned one of the areas. But in developed countries like in Australia, Canada, US, these are labeled as extended scope practice in terms of diagnostics, management, consultation, and research. And an extended scope practice physiotherapist is a clinical specialist who has the opportunity to develop and demonstrate expertise beyond the currently recognized scope of practice, including some aspects of job enhancement or expansion, involving the areas of extended therapeutic, diagnostics, and practice construction. And I will talk more about that. So what are the definitions of this activity? When you talk about the advanced scope of practice, that is like what is happening in our areas now, because you can subspecialize into different competencies as well as significant clinical experience and formal peer recognition when you've done that. And this role describes the depth of practice. You can subspecialize and go on to rehabilitation most of your working time, maybe 60% of your time, or work with those who are disabled, or work with the neurosurgeons, or maybe go into pain management and stuff like that. But when you talk about the extended scope of practice, that is a role that is outside the currently recognized scope of practice and requires legislative change. Because if doctors are supposed to be giving injections in a country and or nurses, and physiotherapists are not legally licensed to do that, then if you are trained to do that, that means that it has to have some official legislation. I'll give you an example. In UK now, because of the COVID and so many immunizations, pharmacists have been licensed to give immunizations. So rather than going to your GPs or your nurses for immunizations, you can go to pharmacy shops and they are trained to do that kind of thing. So in terms of physiotherapy, this additional training and competency development require significant clinical experience. And examples include prescribing, injecting, and even surgery, some forms of surgery. And this describes the breadth of the practice. I gave an example of from what they're showing. One of the reviews examined this role and what are they supposed to be doing: injection therapy, removal of plaster of Paris and K-wires. They are permitted to request further investigations. They could make referrals to other allied health workers. And more specifically, the medical referrals could be to orthopedics, rheumatology, or pain clinics. And in some cases, the physiotherapists may list patients for surgery because they work together with the surgeons and the medical officers in the different specialties. So this multidisciplinary approach, the physiotherapists and orthopedic staff work together, including the various specialty registrars. Training is very important to be able to perform all the roles that I'm talking about. An education curriculum of undergraduate students should be designed. In our own case, should be reviewed. Like the provost was saying, we must learn to move ahead to enhance knowledge and understanding of the roles of healthcare professionals other than their own, and to facilitate skills necessary for collaborative work. I remember when I was in anesthesia, we used, physiotherapy students used to come, and they still go there now for posting. And sometimes the physiotherapy students and the medical students share lectures. This is a way of making them come across each other and understanding their roles better. I'm now in palliative care. I remember Professor Akinpelu brought a set of physiotherapy students to that department for posting, but I think that was the only time. Other times, I don't know what happened, but I will talk more about that later. Interprofessional learning should be both lectures and clinical rotations, because that's the way you can improve perception, clinical experiences, effective communication, and functioning as team members. I can say that, can I have this slide, please? Yes, this slide with the picture. If you look at that picture, maybe you can see some of the people there. That is a picture of one of the conferences of the Society for the Study of Pain. I can't remember whether this was in Ife or in Lagos, but I can clearly see both Professor Olaogun and Professor Akinpelu, and some of the physiotherapists, maybe Professor Okay, and others can even recognize themselves. Because although the interprofessional training is yet to develop in Nigeria, but at that level, at the level of experts, there's already collaboration. And I'm sure Professor Akinpelu, our current president of Society for the Study of Pain, is doing a lot of work encouraging the younger ones to join that society. Because it's not just classroom education. You also have to move on to having experience. One good thing that has been happening since she became president is the monthly seminar. And I know that a lot of physiotherapists who have now subspecialized and who are working with multidisciplinary and interdisciplinary teams have been giving some of the lectures. When you have that kind of group, students' teams are supported by trained facilitators. That is, those who have trained on how to work with other groups, not just theoretical, but on practical levels. And it enables students to develop profession-specific skills in an interprofessional environment. It also allows students to appreciate each other's roles in patient care. Now, the extended scope practice training in Australia involves on average 5 years of experience as senior orthopedic physiotherapist with extensive postgraduate training, including a diploma in injection therapy, and over 10 years of experience working in musculoskeletal physiotherapy. The physiotherapists in the study conducted by Blackmon et al. Had okay, I'll try and finish. I thought I had 30 minutes. So some of them have up to 12 years experience. And in their clinic, in some, they do 6 months rotation. And the 6 months are properly structured. The first 2 months, what they have to do, the third month, and then the final 3 months. And when you talk about teamwork, teamwork is collaborative effort of a group to achieve a common goal. And teamwork makes the dream. Teamwork makes things work. Working in a team encourages personal growth, increases job satisfaction, and reduces stress. And what makes a team successful? Can I have the teamwork slide, please? Yes. Before a team can be successful, you must have good, clear, effective communication, including ensuring that every member is given a chance to speak, even the porter, even the gate man. Because if you have a patient coming to you and the patient has some negative vibes at the gate, that can jeopardize the result of whatever you are doing for that patient. Social sensitivity and ability for members to understand each other's thoughts and feelings, and also respectfully engage in disagreements. There will be disagreements, but you have to be respectful to each other. Honesty, good sense of responsibility, empathy, tolerance, self-awareness, and trust. In terms of interprofessional collaboration, this is considered by many in policy-making healthcare organizations as critical and for effective and safe healthcare. It is thought to improve outcomes of care for persons with complex healthcare. And physiotherapists have positive effects in various studies that have been done from such practice. They comment that they've gained new knowledge, they've been valued in others' roles, and it can be fun to work with other people. So tips for collaboration effectively as a team, effective leadership and role clarification, getting everyone on the same page without being afraid to over-communicate, especially when you are dealing with remote teams. And also to set targets and guidelines so that everybody can follow the rules, give team members autonomy, and measure outcomes and improvements. And that's why we are also in research. So for conditions to provide effective collaboration, this diagram shows that, and this is from Discovery in Action, shared understanding of issues, willingness, commitment, clear and shared goals, mutual benefits, and buy-in into whatever we're doing. And what we're doing in healthcare is our patients and their family. So patient, family-centered care. Using the right skills and knowledge, and also support structures. The provost talked about our support structures in Nigeria. We know that they are not what they should be. And to have more widespread use of professional collaboration. Okay. More widespread use of interprofessional collaboration will require taking into consideration factors associated with patients, healthcare organizations within which we work, whether it's public or private, because in developed countries, about 40% of physiotherapists actually work privately with their insurance organizations or other organizations, and also the wider systems. And the provost has reminded us that our own wider system cannot be complete without mentioning our political system. I wish the younger generation better days in Nigeria. As the younger ones said, of us who are older ones, said that we have seen good days. Yes, we saw some good days, and we pray that the good days will still come for Nigeria. Thank you very much.
Can we put our hands together for our guest lecturer again? Thank you so much, ma. Ma, please, while others return to the high table, we want to take questions for, we know that she's our guest lecturer, but I'm told that we have people that want to say one or two things in addition. People want you to say one or two things more concerning some things you had said. All right, so we'll just take, welcome. Okay, ma'am. Assistant PRO, please. Can I have you in front? Please, we want to take a goodwill message from the representative of the Chief Medical Director, because there's a board meeting going on and they have to leave. So we'll take the goodwill message now before he comes. Put your hands together for the CMD, please, of UCH. You're welcome, sir.
Distinguished ladies and gentlemen, the members, distinguished members of the high table, guest speaker, the host, I want to adopt the existing protocol. The Chief Medical Director, Professor J.C. Abiodun Otegbayo, who is presently at the board meeting, sent me here to deliver his message. What he asked me to say is that on behalf of the board, chairman of the board, members of the board, the principal officers of the University College Hospital, the chairman, medical advisory committee, the DA, and all the other officers, he wants to congratulate the association for this August very successful meeting, and to also to express his desire to be here in person, but to apologize for his not being able to be here. But he wants to say that University College Hospital supports the Association of Physiotherapists maximally, and that he wishes everybody participating in this occasion an excellent time in Ibadan. As we have heard, Ibadan is a state of many firsts. We can't name all of it: UCH, University of Ibadan, College of Medicine, IITA, radio, TV, newspapers, everything first. And the first continues in that tradition. I also want to say that physiotherapy, interestingly, physiotherapy, pharmacy, and medicine, they have the same father, and that's Hippocrates. So we can trace our roots to the same father. And one thing we have learned in the lectures that have been given, humanity is very diverse. There are many aspects to our life. There is the economic aspect, there is the religious aspect, the social aspect, so many aspects. But one aspect that getting it right requires different experts is health. It's only in health that you need a team of experts that are well trained to handle. And it doesn't take long for one to realize that when health is lost, everything is lost. So if there is a place where we need harmony in trying to attain the kind of good health that we need, cooperation of both the patient and the experts together, different teams working as one. The era of disharmony in the health sector, we must work hard to put it behind us. The world is moving on. Physical therapy, which is also physiotherapy, is a key part of healthcare. And without physiotherapy, I don't think it will be complete. Without medicine, it's also not complete. Without pharmacy, it's not complete. Without the nurses, starting from the time of Florence Nightingale, I wish that I could say that nursing profession can also be traced to Hippocrates. But we are working together, and together we achieve excellence. So on behalf of the Chief Medical Director, Professor J.C. Abiodun Otegbayo, and the entire staff and students of this great institution, the University College Hospital Ibadan, an institution whose history, if we are to tell its history, is going to take many years. There are so many great minds that have come from UCH. I'm proud to be associated with the institution. On behalf of this great institution, congratulations, and we wish the association and every member success that we have not imagined. Thank you very much.
Thank you very much, sir. Please, we quickly want to transit to cutting of the cake. Before, sir, Dr. Mike Obaro, sir, before you go, sir, I want you to quickly join us for the cutting of the cake, please. Cutting of the cake, quickly, before you go. And also joining him is the Commissioner for Health, who is ably represented by the Permanent Secretary for your state, of Health. All right, and please, all members of the high table as well, we quickly want to transit to the cutting of the cake, quickly before our guests will go. So we want to please crave our indulgence for us to please go downstairs, just move downstairs. The table is right in front of us there. Dr. Rita Ativie will take it over from here.
We also need one rep from the School of Nursing, UCH. So please join in the cutting of cake. And a rep from the Clinical Nursing Department, one representative from the Clinical Nursing Department to join also in the cutting of cake. Thank you.
We also want the members of the BOT, the members of the ACAPN BOT to come out also for the cut. Very much.
If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joy.
All members of the high table, please join us.
We shall see in this bliss we cannot feel. There are dreams, we stop existing and start living. Then it feels that always love's enough for us growing. Make a better world, to make a better world. Heal the world.
The members of the BOT, please join us.
Get a better place.
Dr. T.A. Odifide, Professor Adedoyin, Elder Babatola Rotimi, Dr. Nnemeka Abano, Dr. Abiola Cole should please join us too. Dr. Abiola Cole. I'm so sorry. Dr. Nnemeka Abano. All the BOT members, please join. Me.
Their swords into plowshares. We could really get there if you cared enough for the living. Make a little space to make a better place. Heal the world, make it a better place.
The significance of this cake we are cutting today is to enhance healthcare dynamics in Nigeria, to a better interprofessional collaboration, to better patient-centered care, in the bid to improve better quality of care for our patients in Nigeria. Thank you. Yes. Yes, we're counting. No, we'll count Oluyole 2022. It's too long. Let's count Oluyole. Please stretch out. You can just stretch. Let's spell ACAPN. Okay. Okay. So. Okay. At the spell of ACAPN, the cake will be cut. A. C. A, B, N, ACAPN.
Together as one. There are people dying.
Thank you very much. While we are still out here, please. While we are still here, Prof, Elder, Dr. Cole, please let's be here. We want to quickly move to the launching of the third edition of Absolute Physiotherapy. Please let me pass this around. Let me give everyone. Absolute Physiotherapy is a show magazine of ACAPN. This is the third edition. It's very educative. In there we have, among other things, the interview of one of our scholars and mentor, Dr. Odole. She tells us about how her journey in our career. We have a lot to learn from that. We have other interviews too. Then we have nice pictures relating the conference in Lagos. Then we also have publications of some of our members. It's very educative, among other things inside. So we need everyone to have this copy. This is the third edition. The first one was launched in Enugu in 2018. The second one in Port Harcourt in 2019, and this is the third edition. This magazine has come to stay. We'll continue to have more editions in the future. So we want us to quickly launch this as we continue with the program. So I want to invite the Commissioner for Health to say something, and then everybody to launch it, and then all of us will just say something. We just need this magazine to continue, the production to continue. Thank you very much, sir.
Well, let me just say, on behalf of the Honorable Commissioner for Health, who will have loved to be here but unavoidably absent, to recognize the role being played by our physiotherapists in healthcare service delivery in Nigeria. And on behalf of the Honorable Commissioner, we are launching this magazine, Glory of God and Benefit of Humanity. Long live ACAPN, long live Oyo State, and of course, long live Federal Republic of Nigeria. Thank you very much.
Can you put your hands together for the Honorable Commissioner, ably represented by the Permanent Secretary of the ancient Oyo State. Thank you, sir, for making out the time. Well, I know you have not gone through the magazine, but I can assure you that the content that's scintillating as the production. Can you, sir, on behalf of yourself, sir, and also the Commissioner, Honorable Commissioner, say something about this magazine, sir?
Well, I think you are putting me in a difficult position. I've not gone through it. I'm just seeing it. But I can say that it's colorful. I can say that it is beautiful. And I can say that it has beautiful pictures of distinguished erudite colleagues in physiotherapy. And of course, on the front page, it's a colleague of mine of more than 40 years. We were together during HSC at Oyo State College of Health Science and Technology, Health Science. That's ATIFE. And I'm talking about Dr. Adesola Odole, who happened to be the chairman of the local organizing committee of this Oluyole 2022. And of course, we have green color there, which signifies Nigeria. And of course, looking at the production, you can see there is hope for this nation. There will be light at the end of the dark tunnel. Thank you very much. So you want me to support you financially. And because I'm a civil servant, and because I'm representing the Honorable Commissioner for Health, I will tell you that before the end of this week, send a bountiful donation to the support of continual production of this magazine. Thank you very much.
Thank you very much, sir. Now, moving next to my left, I have representing the CMD. Thank you very much, sir.
Thank you very much. Just to also congratulate the association for this beautiful product. It shows how colorful and how beautiful physiotherapists are, and they also make our lives colorful. One thing that the CMD says is that the most important thing to do is to do the right thing. Now says that the next thing to that, to let people know that you are doing the right thing. So I think this magazine will let us know that the physiotherapists are doing the right thing. So on behalf of UCH, I don't know, although he told me, I didn't have an idea that I was going to be at this, but he told me just go there, whatever they say you should do. Yes. So I know that he's interested in this because I got hints that there may be something that has to do with money. So I got something like that. So I can assure you that the CMD will send his own contribution on behalf of the hospital to your association. Congratulations.
Prof, maybe we'll proceed like that. Thank you, ma'am.
Just to add my own wonderful birth and rebirth of your magazine. As everybody has said, it looks very beautiful, and I'm sure that as you go on, the content and what you are delivering to your association and to policy, as the Vice Chancellor, represented by Provost, has stressed, will also be contained in this. Congratulations, and many, 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 many more years of fruitful deliberations and contributions to our country, Nigeria. Thank you.
I want to congratulate the. I want to congratulate the producers of our Absolute Physiotherapy magazine. I know so much work has been done in this, and I pledge to support this work with a sum of 20,000 naira.
Thank you very much. I'd like to congratulate the ESCO for sustaining the production of this absolute physiotherapy. It started during my time as president. I want to congratulate you for sustaining the production. I will not disclose my contribution to this because they are owing us 8 months' salary. So, but I want to promise you that I will launch 1,000 copies. 1,000 copies with 10,000 naira. Yes. I'm just joking.
That's okay. Okay, as it is now, I have very strong passion for anything that has to do with ACAPN. And you know that for the past 8 months, lecturers have not been paid. But somehow, I'm sure they know, I will definitely make something that is worthwhile of my passion for the association. Thank you.
Thank you very much. Now, the chairman of the Board of Trustees, ACAPN. Oh, the president is the coordinator.
Okay, well, I want to join quality of this man. As we were told, the last was in 2019. And over the year, I came to believe that that was the end. But thankfully, we have it in 2022. Do we now come to believe that it comes out every 3 years? Anyway, that notwithstanding, like my others have said, you know what I do for a living? I'm a lecturer. And, and 8 months going. In fact, thank God I'm still surviving. So, but that notwithstanding, I will get across to you. I can't. Hello, President. I know you are not expecting anything from me. Okay. Okay, I will support with 10,000.
Please put your hands together for Chairman BOT. The Director of Physiotherapy Services of your state. Please put your hands together for the Director. Thank you, ma'am.
I thank God for the opportunity to be here today. And I thank God for all physiotherapists that are here. This is just like how it used to be in those days. And I know that a time is coming when all of us will still be together again. I know that God will make sure that it happens very soon. I will be launching this with just a token that I will send to the committee. Thank you.
I'll send him my own token just to encourage. Thank you. Well, I will support it, but I will wait till I have the 35% increment. I will send my token.
Well, straight to the point, we know it's all about money. We're talking about, no doubt the quality is high and then better than what we used to have. For me, I think I want to launch these 2 copies for 10,000 naira.
Thank you very much.
Okay, thank you very much. Please, a round of applause for our elders in the profession and our invited guests. Please, we want to quickly call on some of us that are still here to make donations. We want to call on Dr. Aweto. Dr. Aweto, please. Take a copy to her. We'll send our account details.
Hear the children crying. Hear the children crying. Saying, give thanks and praise to the Lord, and I will feel alright. Saying, let's.
Okay. The production looks very good, and I'm sure you spent some money to do this. So I'm going to send something. No, we've not been paid, but we're looking forward to being paid soon. I'll give something. Thank you.
Thank you very much. I know we have not been paid, but I know many of us don't depend on the payment. I want to call Honorable Toby. Please, the mic to him. We'll soon continue. We'll proceed with the other events. But let's have him say something.
So shall it be in the air.
That's Honorable Tomi Ojetunde, right?
One more thing. Let's get together to fight this holy Armageddon. So when the man comes, there will be no doom.
Good afternoon.
Have pity on those.
Dr. Ativi. Okay. I want him to, can we stand up? Can we see him? Okay. Okay, thank you, sir. I want to see you, sir.
Good afternoon. Permit me to stand on the calls. I will launch this 5 copies with a sum of 300,000 naira.
Thank you very much. Please, another round of applause for him. I'd like to call on Dr. Joao to make his own donation.
Asùparapọ̀ nìyẹn o. Okay, I will get in touch with the organizer with 5,000. 2 copies.
Round of applause for him, please.
So the launching continues. We have more copies, and the account details we have on the screen. So anyone can reach out to any of us here. We are available. Thank you very much. A round of applause for all our donors and the ones that are here to donate. Thank you and thank you.
Can you put our hands together for Dr. Rita TVA, please? Thank you so much. And finally, we want to take the good rule message from the Commissioner for Health for your state, here represented by the Permanent Secretary of your State's Ministry of Health, Dr. Soji Adeyanju, and he will also declare the opening ceremony closed. After which, immediately we will take group photograph, please. Immediately, he has declared the ceremony closed. Welcome, sir. It's also the closing remarks. So, and then he's also declaring the ceremony closed as well.
Good afternoon. I'm tempted to let me just stand on it. Program. Tell yours. Chairman of this happens as Chancellor of my own Faraday, Adibo Waliemen, was ably represented this day by the first female provost of the College of Medicine, University of Ibadan, Professor Omibodun. I also want to recognize the CMD in absentia, Professor J.C. Otegbayo, was ably represented by Dr. Obaro. The keynote speaker, Professor Aderunke Akinpelu, and of course our guest speaker, our mother, Professor Olaitan Tunyanwo, who happens to be a mother to many of us that are here. I want to also recognize the chairman of BOT, Professor Adegoke, and of course the president of ACAPN, the golden president, Dr. Kafo. Of course, my good friend, chairman of local organizing committee, Dr. Adesola Odole, the esteemed members of Association of Clinical and Academic Physiotherapy of Nigeria, and the students that are here present. I want to acknowledge the presence of our matrons who are actually representing our nursing from Clinical Nursing Department of University College Hospital, Ibadan. Gentlemen of the press, ladies and gentlemen, I want to say on behalf of my Honorable Commissioner for Health, Dr. Olabode Taiwo Ladipo, we want to appreciate the Association of Clinical and Academic Physiotherapists of Nigeria for inviting us to be part of this noble 6th Scientific Conference and Annual General Meeting of this association. Like my provost actually mentioned when she gave her opening remark, looking at the theme, healthcare system dynamics in Nigeria, the patient, the physiotherapist, and the public. When I looked at it, the first thing I was thinking about is to look at the number of registered physiotherapists in Nigeria. And I saw 2,450 registered members of physiotherapists in Nigeria. And I looked at the global ratio of physiotherapy according to the population. It's supposed to be 1 to 4,000 people. And in Nigeria, we have one of the worst ratio of physiotherapy to the general population. 1 to 170,000 people. And if you look at this need, you find out that it's enormous compared to our general population. Coupled with the fact that we do not have many accredited higher institutions where these professionals are actually being trained. We are told that we need up to 42,500 physiotherapists to cater for the good people of this nation. And looking at the roles of physiotherapists, right from neonatal age group to geriatric age group, you find out that the need is enormous. And we need more. And we look at what are we doing in Oyo State with respect to issues that concern the welfare of physiotherapists. I want to say to this noble audience, as of 2019, when I got to the Secretariat as the Director of Medical Services, physiotherapy was a department under the Directorate of Medical Services. But today, as I stand before you, physiotherapy is a directorate, as a directorate in the Oyo State Civil Service. Secondly, the entry point for physiotherapies when I joined the state in 2019 was grade level 9. Today, entry point for physiotherapists who are newly employed is grade level 10. We have limited number of physiotherapists in the state, and 2 years ago, His Excellency, Engineer Seyi Makinde, the Executive Governor of Oyo State, gave approval for appointment of healthcare workers. And of course, physiotherapists were among people that were actually recruited to the civil service in Oyo State. And on quarterly basis, the chairman of the Management Board ensures that the consumable and materials that were actually needed in our different facilities where we have physiotherapy department are actually being procured, and this is given express approval by the state secretary to the state government. The state is actually committed to the welfare of all healthcare workers, irrespective of their cadres. And let me also add that the state government rests on the 4 pillars: education, health, security, and economy. The government and the governor of the day believe that if you have educated mind like us, who are healthy, and they are in a secure environment, it will lead to economic development. So the state is committed to the welfare of all cadres of healthcare workers, and I can only wish this noble association is successful, and of course I believe it's been successful, looking at all the lectures that I have listened to. And I believe that by the special grace of God, this association will take the Society of Physiotherapy in Nigeria to greater heights. And God will use all of you, especially those of you who will not get out. Of the 10, or more than 10 people, physiotherapy were actually recruited last year. Some of them are actually living for greener pasture. But for those of us who placenta are buried in Nigeria, let us remain in this country and take this country to greater heights. On that note, I want to wish this noble association a successful scientific conference and annual general meeting. And I'm also using this opportunity to draw a curtain to this opening ceremony of this scientific conference. Thank you very much, and God bless you.
Please put your hands together for the permanent secretary. And now I want to hand over to Dr. U.S.T. Oka for the president to present awards to all our distinguished dignitaries. President, sir.
Thank you very much. I think we have had a very good day, and I want to, at this point, honor our guests and our speakers. And we're going to start by honoring our chairman, who could not state at this point, the Vice Chancellor of the University of Ibadan, ably represented by the Provost. But we have an erudite professor of the university that's going to take the awards on their behalf. So may I present the awards to the Vice Chancellor. May I invite the Chairman Board of Trustees, Professor B.O.A. Adegoke, to please receive the award on behalf of the Vice Chancellor. Thank you very much. Please decorate the Vice Chancellor. On behalf of the ACAPN, this is presented to you, the Vice Chancellor, University of Ibadan, as the chairman of the occasion. Congratulations, sir. Thank you. Also to receive for the Provost College of Medicine, on behalf of Professor Omikoju, the Provost.
I have waited patiently. I have vision, oh I believe. I know I can.
Okay, to invite to receive the award, may I invite to receive on behalf of the CMD, Dr. C.A. Odole, please, to receive on behalf of the CMD.
I was built to be the best, number one and nothing less. Lead
To
me
present the
my
award, let me
destiny.
invite Professor Adeti, please. Let me to present the CMD of UCH. Professor Adedoyin, please. Thank you very much.
Stand up, stand up, stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up.
This award of recognition is presented to Professor J.A.O. Otegbayo, PMD of UCH Ibadan, guest of honor at the conference, annual general meeting, Association of Clinical and Academic Physiotherapists of Graduation.
Getting close, now it's just who wants it most. It's just life, that's how it is, because we have our strengths.
Okay, also to present to the Honorable Commissioner of Health, Oyo State, ably represented this afternoon. May I hand over also to Professor Adedoyin.
You see, I'm on the move, make way for me. So stand up for the champions, for the champions. Stand
This
up.
award of recognition is presented to Dr. Bode Ladipo, Honorable Commissioner of Health, Oyo State Ministry of Health, as a special guest of honor at the 6th Annual Conference and Annual General Meeting, Association of Clinical and Academic Physiotherapists of Nigeria. Congratulations, sir.
And when I fall down, I have
Thank you very much. The last set of awards to our distinguished guest and also our keynote speaker. Let me invite Professor B.O.A. Adegoke to please make this presentation on behalf of ACAPN. The Chairman Board of Trustees, Professor B.O.A. Adegoke, please. Let me invite our guest speaker, Professor Soyonwo, please, to rise and receive this award of honor on behalf of our association. Thank you.
And when I fall down, I have to pick myself back up. And when I fall down, I have to pick myself back up. And when I fall down, I have to pick myself up. Stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up.
My honor and privilege to present this award of recognition to friend Professor Python for being the guest speaker at the 6th Scientific Conference and Annual General Meeting of Association and Academic Physiotherapists. Thank you for coming, sharing those words of. Thank you very much.
Very much, everybody. This is well appreciated. Thank you.
Thank you. But please be asked together once again for Prof. And let me invite our mama in physiotherapy, our keynote speaker, Professor Aderonke Akinpelu, to receive her award of honor. Thank you, Prof.
Finally, God has called you. I have to make this presentation to you. Now you know your guy. Well, it's my honor and privilege to make this award of recognition to my classmates from secondary school, my friend, my next door neighbor, Professor Aderonke. Should I say the rest? Akinpelu, as for being the keynote speaker at the 6th Scientific Conference and Annual General Meeting of the Association of Clinical and Academic Physiotherapists of Nigeria. We thank you for coming and we appreciate your contribution. Thank you very much.
Nothing less, lead me to my destiny. I have waited patiently. I have vision, oh I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up, stand up for the champions.
All right, we are bringing the opening ceremony to a close. May we all rise for the national anthem as we close this opening ceremony. But please be informed that immediately after the national anthem, we will all have group photograph here, but it is in batches, okay? Our guests will be seated with the BOT, the NEC, the directors, the heads of departments, then the students. After which, we will all go for product exhibition immediately after the national anthem and the group photograph. Thank you very much. The national anthem, please. Thank you very much. Please, let's take the group photograph now. The proof that you came for the conference is in the memories. So may we have members of the I table, please, and our elders in the profession. Please, let's take our seats. Please, this is not the time for you to leave. All the people here represented will still need you to be in the pictures, please. Everyone represented here will need you to be in the pictures. Everybody here, there's a category of pictures for you. So please do not leave.
It's Jewies on the beat.
This is another Oluyole. Make I tell you what I go for a bullet. Oh, this big party inside my bullet. I went there with my best.
Please, immediately after the group photograph, we all are supposed to go to the exhibition stand now. It's part of the program that we ought to observe.
Oh shit, I get many girls with they come from away. DJ boys and they like to throw it. Almost go babe.
We have about 20 minutes for product exhibition, 20 minutes. We'll be coming back after the exhibition for the next session so that we can finish up on time.
Hold on, that's why I hold on tight. Hold on, hold on tight. Hold on,
Alright, can we have members of the National Executive Council? Members of the NEC, yes, members of the NEC, please. Members of BOT, BOT members, NEC members, please can we have you? Heads of departments, directors. Heads of departments, directors, HODs, deputy directors, assistant directors, professors, HODs, deputy directors, program coordinators, deputy directors, ADs, please. Members of NEC. Members of NEC, please. Everybody say Ibadan.
When I show,
students, please get ready. Let's say Oluyole. All right, no, please hold on. Can we have the students reps, please? Elders, please remain seated, please, ma'am. Please remain seated. Thank you very much. All students reps, please. Students from different institutions, can we please come and take our pictures? Intent core members, please. Representing different institutions, can you please come and let's take pictures with the elders? Students reps, please. From all universities here present, Unimed, Bowen University, UNN, Unizik. Students from different schools, please come. All students, please. We have enough space that can take you. Students, please. This is the moment that the memories will be preserved. Physiotherapists, please get ready. All physiotherapists, please get ready. interns, core members, students, please. Yes. Everybody say ACAPN. Tell people to move. You can go behind, you can climb the podium. You can climb the podium. There's a space here. There's a space on the podium here. Yes, you can climb so that we can get people, more people in the pictures. Please, you can go on the stage. Instead of coming like this, you can go on the stage. You can go to the stage. There is space on the stage. Otherwise, no picture will capture you here. Let's go to the stage. Let's spread. You can go on the stage. There's enough space on the stage. Therapist, please. Oh my goodness.
Prove that I want you. Prove that you're everything, everything. The way you did do it, I know if you complain, because it is sweet me. My body they shake. Oh baby, they tina na my body, tina na my body, tina na my.
Physiotherapists, all physiotherapists, please. Let's take our pictures. Let's take our picture. All physiotherapists, please. Physiotherapists, young physios, younger physios, young physios. Let's take our pictures, please. Physiotherapists. Physiotherapists, please. Physiotherapists. Physiotherapists, please. Are we not physiotherapists again? Physiotherapists. Mr. Folabi. You're not a physiotherapist. Physiotherapists. I just like to remain in here. Physiotherapists. Physiotherapists.
I stand for you. I wouldn't lie to you, but I feel
physiotherapists. Go in.
Get up down for you.
Go in. Ready to go. Physiotherapist.
Baby,
say Oluyole. Say conference. Say ACAPN.
I dream a voice on this beat.
Thank you very much. Please, let's all go to the exhibition stand now. Please, it is very, very important. We are going to be led by our exhibition lead, PT Ada Okonji, who will lead us to the exhibition stand, showing us the various products there so that we can all look at it and buy. Thank you, sir. Please, let's go to the exhibition stand now. Let's go now, please. Directors, HODs. exhibition. Can we all go row by row? Can we all go row by row now, please, to the exhibition stand? Because we have to come back inside for the panel discussion in a few minutes. Please, can we all go now? Directors, HODs, physiotherapists, senior lecturers. Please, let's go now. Please, let's go to the exhibition stand. Please, it's important. It's important, please. Let's go now. Students, you can go. There are free things for you. They have a lot of free things. Go and check out the products, please. Let's go for the product exhibition now. We are coming in a few minutes to continue the plenary session. Please ensure you visit the stand. There are free gifts for you there. There are free gifts for you at the stand. Please ensure you visit the exhibition stand. Thank you.
àgbàtọ̀mọdé ẹ̀ máa yọ́nú sí mi o ọkùnrin tóbìnrin ẹ̀ yọ́nú sí mi.
Please, let's go to the exhibition stand. Can we go to the product exhibition stand, please? It's part of the conference. It's part of the conference, please. You should not leave here without going to every stand. Can we proceed now to the product exhibition stand? Take a look at those products, please. For the students, the quiz competition comes up by 4 p.m. Students, the quiz competition comes up by 4 p.m. The first stage of the inter-university quiz competition comes up by 4 p.m. today, right in this hall. The inter-university quiz competition comes up by 4 p.m. today, right in this hall. All universities here represented. I hope you have 3 people from your university that will represent you in the quiz competition. By 4 p.m. in this hall, please. All universities should get ready. Can we all please proceed to the product exhibition stand? Thank you.
Girl, I'm in love with your booty bounce. Girl, I'm in love with your booty bounce. In love with your booty bounce. Girl, I'm in love with your booty bounce. Girl, I'm in love with your booty bounce. Girl, I'm in love with your booty bounce. In love with your booty bounce. Girl, I'm in love with your booty bounce. When I wear it, it weigh 1,000 pounds. I go like
Tọ́lá mo bọ́lá jí mo jí bọ́lá mo fẹ̀sọ̀ kọ́ bọ́lá ti tó. Sílẹ̀ màá bá wọn ká tán délẹ̀. Kólóbá kólóbá.
Ọlọ́ládé mi Àṣàkẹ́.
Pàdí mi ọ̀sùn lọ, lójú ìgbà tí bá ní kó bọ́ọ̀kù lọ. Àlàyé mi sáré tẹ bọ́ọ̀tì lọ. Gbogbo nǹkan kọ́ ló máa fi ń jọ̀gọ̀jọ̀. Ká lọ ṣe shopping jọ. I know they send that they job my life. 100% we dey gbádùn lọ. Àwọn tí o fẹ́ wa kọ́ máa struggle lọ. The money long cause I don't buy shit. Now everybody want to tear my shirt. I just blow but I know myself. Before them use me, I go use my sense. Ọmọ bá ló ń pàṣẹ. Anita go down sẹ́. Ọmọ dúdú ọmọ pupa èmi lọ́ máa fẹ́. Ẹ̀ńjọba méjì ló máa jẹ́. Asalamu alaikum. If I get many desire, Eshkaka, Oshida, Oluwa shower me your blessings in every situation make I know you. If you shall come on, don't forgive me, but it's a life you I'll never let you go. You let me go. You go see now I found another radio. You can pack your load. I'll never let you go, but you're letting go. Why you let me go? You go. I have found the one from you. Find the one from you. Now you want me back. I said go back yo. I know they do. Right now I am fine and cool. I'm fine and cool. Make my money really pay.
Tune into the king of songs and blues.
Ọlọ́ládé mi Àṣàkẹ́.
This love you getting me for my body. I wanna find with my life. This love I'm looking for my mommy. My banana, my banana, go to my banana. Show me power, I want me to walk. And let me know my life. She want like I be my like I was Sultana. Cause you play a move, anything I want to do. If you look at mine, I can be on my car. If you don't know, I'm something that you're slow. My banana, oh my banana, much of my banana. Johnny power, but they go out. And let me love my life. She my like, I hate my like, I my Sultana. Cause you did, I'm
Dead on my flow. If you don't get to I'm a day we get to I've been inside playing Call of Duty. Loving be my Call of Duty. Say follow me to and give me. And this all I want is sex. And doesn't make her upset. Girl, you have to bring your friends. Cause girl have to be my friend. And we have a show by then. So we have to leave by then. Oh, I mean, they don't care. Cause I don't need to show myself. Now I just want to marry her. Oh my designer. Take your window, marina. It's the life for the side.
Don't sleep, wake up.
Collect your money,
collect your money. Speak, wake up.
collect your money,
collect your money. Wake up, wake up.
Money to kaya, kaya kuya, don't walk, you don't try. You supposed to do try. Kill up, come save my town, person we don't mind, boy. When I land the land softly on the so far so good. Don't need my joke, let me see you. Let me see you. Let me see you, the buga. Let me see you. Let me see you, the buga. Let me see you. Wake up, supposed to be high. Kill it, go home, share food, water. They see what I'm buying. When I land that last Sophie on a sofa floor. So far, so good. Don't need my job. Let me see you. Let me see you. Let me see you. Let me see you.
More music on trendybeats.com.